Hello, Medicare Advantage Risk Adjustment operators, innovators, and learners. Welcome to another learning series of the Hills Academy Risk Adjustment Made Easy, the Medicare Advantage kind. Thank you for joining us today. If today is your first time that you are joining our learning series, we want to welcome you here. If you have been with us, also we want to say thank you and welcome back. If you are new to the channel and you have not subscribed yet, I will encourage you to subscribe to the channel. As you learn and study with us, I will also encourage you to like, to share, to comment because it helps us to reach a wider audience. My name is Dr. Prince Beua. Let's jump into today's lesson. Over this month, we have been studying on 4 Medicare Advantage risk adjustment stakeholders that you need to know as you work in this space. And last week, we covered AHEP, which was formerly called American Health Insurance Plans, but now it is simply called AHEP because they have widened their sphere of influence and their membership. If you have not watched that video yet, I will encourage you to watch it, and there will be a link in the show notes down so you can quickly catch up on what we studied last week. And today we are looking at Better Medicare Alliance, BMA. That is another stakeholder that you need to know as you work in this Medicare Advantage risk adjustment space. So let's get into more details with who BMA is. BMA, similar to AHEP, but a newer one, was established in 2014, as you can see from here. And it brings together over 200 ally organizations that include healthcare providers, insurers, community groups, advocacy organizations, and grassroots beneficiary advocates. So this is also diverse as a coalition for Medicare Advantage. And BMA's mission is to build a healthy future by advocating for a strong Medicare Advantage. So within this Medicare environment, BMA is also another organization that is a huge advocate for Medicare Advantage. And as you can see from here, we are BMA, a community of experts leading the way forward on healthcare, driven by a common goal to support Medicare Advantage. So it leans towards Medicare Advantage. We are individuals and organizations moving the needle forward on care, including Medicare Advantage beneficiaries, caregivers, health plan, doctors, hospital, advocacy, and agent organizations. So as opposed to AHEP, that was initially health insurance focused, but now has expanded, BMA focuses on the broad spectrum of Medicare Advantage. So they bring in a variety of stakeholders within Medicare Advantage sphere. For AHEP, it has membership. BMA calls it ally organization, or allies. BMA allies commit to the mission of BMA to support and sustain Medicare Advantage as an option in Medicare. And the allies agree to work with BMA to promote the value of MA as part of Medicare that offers health coverage that is comprehensive, high quality, affordable, and valued by Medicare beneficiaries for the enhanced benefit, affordability, simplicity, and care coordination that it offers. So you can see BMA as, at least from looking at the descriptions of BMA, it brings more stakeholders together and put Medicare Advantage as number one, not necessarily insurance focused, but across organizations and even to patient advocacy to help foster the growth in Medicare Advantage to work for the beneficiaries. Moving forward on BMA's work in Medicare Advantage and risk adjustment, just like we looked at last week for AHEP, BMA also does advocacy and policy development, and you can see from different engagement with policy makers to promote accurate and stable risk adjustment policies. BMA publishes research and reports, so you will see that as we go to their website. And then BMA doesn't offer training and certification per se, but BMA works with training and certification programs to make sure that things are implemented effectively to support MA and risk adjustment within the Medicare Advantage space. So we will move on to do a quick run through on BMA's website. So you can get to BMA's website is the Better Medicare Alliance here. And then once you get there, you will see a leading voice in Medicare Advantage. Because it's Medicare Advantage focused, you will see most of the things that are being talked about here are Medicare Advantage focused. So analysis of 2025 Medicare Advantage plan landscape. You can navigate through the advocates, what stories that are being talked about. You can see things in policy, thought leadership, and advocacy. Those are the work that BMA focuses on. And there are some news that are pertaining to Medicare Advantage. And to be an ally, you can see here, allies. You can navigate to see some of the ally organizations that are here. So AMCP, Eat Right, Aetna, HSPAN, Audiology, and you can go on and on. You can see several allies that BMA has. A quick way to filter to look at is there are advocacy organizations, there are aging service, there's benefit plans, health companies, health systems, Medicare Advantage plans, and you can see a variety over here. And then you can navigate to their sites. You go to policy insights, resource library, where you can download and look at several resources that BMA publishes for free that you can download from here. And there are government affairs, Medicare Advantage, several resources from here that you can really learn, get insightful information from navigating through BMA's website and the resources that BMA offers. But note that as you navigate through their website, they are Medicare Advantage leaning, and therefore you get a better understanding to be a savvy consumer as you navigate through their website. That is what we have for today. Learning and introducing you to some of the Medicare Advantage stakeholders that you need to know. And we hope this was very helpful and instrumental in your learning in here. I will encourage you to subscribe, to like, to share. And if you are not already a member of our email list, get on, because you don't want to miss some things that we send out from the Hills Academy. And you also get a privilege to have our signature gift, which is From Chaos to Clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data sources, which compares risk adjustment data sources easily for you for free. And we'll catch you next week, and bye for now.